Hi, my name's Abby. I'm going to be your student nurse today. I'm going to repack your wound for you. Let me check the orders and make sure that Doc still has that in there, your physician. Yep, right there, wound packing for you. I'm going to move your tray. And then can you tell me your full name and date of birth? Sue Quinn, 7/21/1951. Okay, that's what I have. And then do you have any allergies that I need to know about? Levofloxacin and strawberries. Okay, I will not be using any of those today, so you don't need to worry about that. I'm gonna go ahead and pull my tray up so I can use it to hold my stuff. I'm gonna hand sanitize again. I'm going to take one of these wipes so I can clean my tray to make sure that there is no bacteria or anything on that, because we don't want anything getting into your wound as we open it up here. And then this you would leave wet for 2 minutes. But for the purpose of time, I'm just verbalizing that. And then I'm going to deglove. Hand sanitize again. All right, let me get my supplies. Okay, I have my sterile saline, my packing strips, my moisture pad to put over my patient, my biohazard bag, and my packing kit, my wound packing kit. Okay, I'm gonna lift your bed up a little bit just so I can reach you a little better without hurting my back. All right, I'm gonna move my trash can over to where I can use it with everything. I'm gonna go ahead and hand sanitize again since I was touching on things. All right, now I am going to pull down your sheet and pull up your gown so I can expose your wound here. I'm gonna keep you covered as best as I can so you don't feel exposed or anything. All right, next thing I'm gonna do is I'm gonna put a little pad here to keep anything from dripping onto you and from getting on your sheets. And then I'm gonna put a biohazard bag right over here, if that's okay, so I can throw all of, well, anything with your bodily fluids in it we don't want in the regular trash can. So I'm gonna put that there for me. Okay, and then I'm going to go ahead and hand sanitize again because you can never be too sure. And I'm going to get some clean gloves. And I'm going to go ahead and remove your packaging. One thing I did forget to ask you is, are you experiencing any pain right now? No? Okay, well, if you do experience any pain during the whole procedure, please let me know, okay? All right, I'm gonna try to do this as best I can, so keeping you comfortable, but it can be kind of painful sometimes taking the tape off. Okay, I'm gonna take off one side at a time. There's one side, you're doing good. Okay, and then the last side. Okay, so I'm looking at the bandage for any drainage, noting the color and consistency of it. I don't see anything on here, so I'm gonna go ahead and throw it in my trash can. And on this first pad, I see some serious drainage. It is just clear and very thin. So I'm gonna go ahead and put that in my biohazard. And then this second gauze, I'm seeing the same thing, serous drainage. And then this final gauze on here, I'm seeing some serosanguinous drainage. It is kind of bloody, but mixed with clear fluid. Oops, I'm so sorry. And then I'm going to pull this out. I'm so sorry, this is not very comfortable part. Okay, I'm looking at my packing. There is a little bit of serosanguinous drainage on there. So I'm gonna go ahead and put that in there. Next thing I'm gonna do is I'm gonna assess your wound for Rita, which is redness, and I see a little bit of redness around your wound, but that's kind of normal, especially when we're messing with it. I'm gonna look for edema, any swelling, and I'm not seeing that. I'm gonna look for ecchymosis, which is bruising, and I'm not seeing any bruising around it. I'm gonna look for drainage, and like I said, I just saw that serosanguinous drainage on there, but I'm not seeing any oozing out or an overly large amount of it. And then lastly, I'm going to see if it is approximated, and that just means if your wound is closing together, which yours is not yet because we're still packing it and keeping it open. So no approximation. I am going to take my gloves off and hand sanitize. Okay, I have all my supplies. I'm going to go ahead and open up my package. I'm just going to go ahead and put that in the trash. Okay, so we open away from us first. When I open this side, I'm gonna pull it a little over so I still have room to take off my gloves and everything on that side. Being careful not to touch more than 1 inch on the inside, and then I'm gonna go ahead and dump out my package. Okay. And then I need to take these gauze out, which I'm gonna try to dump them again because I know I can't put my hand in there. Okay, I'm just gonna go ahead and pull them out. I know I wouldn't be able to do that, but I really can't get them out of the package. So next thing I'm gonna do is I'm going to open my saline and put this like that. So, and then it is, packaging looks good, expiration date is still good. It expires 12/2028. I'm gonna put my hand over the label, dumping away from the label and putting just a little bit in the trash can. And then I'm going to fill 2 of my parts. I'm going to go ahead and switch hands so I'm not crossing my field on this one. Okay. I'm going to go ahead and open my packing up. And I think that is the last thing I need to do without sterile gloves on, so I'm going to go ahead and sanitize again. And then grab my sterile gloves out of here. I'm going to open them up. going to try to move around my packaging so I don't get my sterile gloves to cross this field. Okay, so first thing I'm going to do is grab the little cuff here. Which this is however you get it on, that's how you leave it till you get your other glove on. And 4 fingers under. Okay, and then I'm sliding this off and letting it fall into the trash can. Now I can fix my fingers on here. I cannot pull below my hand, so I'm just going to pull from my palm here. Okay, first thing I'm going to do is I'm going to add some gauze into my sterile saline so I can clean up that wound. 2, 3. Push those down in there, and now I'm going to grab my packing. I'm looking to see about the length that was in there before. And then these would be placed in the sharps bin, but I'm just gonna put them over here for now because we don't want to put anything in the sharps. Okay, so my next thing I'm going to do is I'm going to clean the wound. So I'm going to take this packing and make sure it is getting that sterile saline on there, or the gauze, not the packing. Goodness. Squeeze it out. I'm going to go over to the wound, being careful not to let my sterile gloves touch his skin. And I'm going to just do a circle on the inside, and then Biohazard. Getting another gauze. Then same thing, I'm just going to do it a little further out. Circle, and then Biohazard. And then final one. I will circle and then Biohazard. Okay, now what I'm going to do is I'm going to want to pack that dressing. So I'm going to pull this out and I'm going to wring it out. Try to get as much of that solution out of there as I can. Okay, and then I'm going to take my cotton tip and I'm going to wrap it around 1.5 times. I'm going to pull this up to the top, bring it over, and careful not to touch the outside of the skin. I'm going to pull it in and release the end of that gauze, and then put it in. Then I'm going to leave just a little bit out so the next person has something to grab, and then Biohazard because it was in their body. And then the next thing I'm going to do is I'm going to add gauze to the top. So I'm going to grab 3 again. Okay, so here's your first layer. Here's your second layer, and then your third. And now I'm going to add this big bandage on top. And then finally, I'm going to tape 3 sides, and you only tape 4 sides if there's an order for that. Now I'm going to put that over there since I made it kind of small. Okay, I can put that back. And then I am going to remove my gloves. and put them in my biohazard bag. And then if this had anything on it, which it does not, I would also put it in there. But I'm going to take my biohazard bag and put it in the biohazard bin. And I'm going to take this off and throw it away. And now I'm going to put the date 10/7. The time is 1600. And then my initials, just to show when it was last changed, and at what time and by whom. I'm going to go ahead and cover you back up now. All right, if you experience any discomfort or anything, or if you start feeling any pain, please let me know. Your call light is right over here. I'm just gonna finish cleaning up real fast. Okay, so all of this would go in the trash. These back so I could return them. Put this tray back down. Trash can back. There's the tray. I'll take these for you. And the last thing I'm going to do is I'm going to document. So, wounds change on Sue. Noted slight redness, but nothing else in the Rita. Okay. And then I'll sanitize and walk out.